So those are the helpers that we're going to talk about helping. And I am knee deep in this research right now, so that's good news, I hope, because I have a lot of information to share. I don't know, that might be bad news, but there is a lot that I want to share. I am going to keep it, I'm going to watch my time, keep it to an hour, so there's time for questions. So let's just get started. This is what we're going to talk about. Oh, I will say, let me just add a little bit to what Lori said, because I just got this question yesterday, like, why did I do my research on this topic? And I have been involved in animal rescue for most of my adult life, and I've actually, I don't know that I've personally experienced compassion fatigue, but I've seen it. I'm fairly certain in a lot of my animal rescue colleagues. I also have friends who are in the veterinary profession. I think it's something, and the research does show it is something that is prevalent in this community. And I just think it needs more attention. And so that's really what drove me to this topic. And so what we will talk about today is what it is, some related terminology in the literature that often gets confused with compassion fatigue, symptoms, who's at risk. I'm going to share a model. I have two models I want to share with you that are very widely used across the research on how compassion fatigue progresses. And then we're going to talk specifically about the factors of animal care work that contribute to the onset of compassion fatigue. And I think all this is so important to understand how we can most effectively help animal care professionals, because they are unique in what they do and their work is very unique. And I think that's critical in ensuring that we can provide the best help for them. And then we'll get into how we can help and how we deal with different populations, and also how we as helping professionals, because I know many of us on here are in psychology and helping others, how we can help ourselves. Okay, so let's start with what compassion fatigue is. And many of you may be familiar with this, but it really is that emotional or physical exhaustion that can occur when a caregiver is so deeply concerned about their patient and they're trying to alleviate their patient's suffering, but their inability to do so creates despair, really, and can cause the onset of compassion fatigue. So this compassion fatigue itself the term was first coined by a nurse, last name Joynson. You see her referenced here on this slide, because she was experiencing these emotions and noticed them in her colleagues. And she wrote a big article about it. And there's been a lot of research done on compassion fatigue in helping professions, think, doctors, nurses, therapists, even emergency personnel, and not though as much in the animal caregiving community until most recently, maybe the last 15 years. But it was all this other research that's paved the way for the research that's now in the animal care community. Compassion fatigue is accompanied by an emotional bond. That is one of the unique distinctions in what causes it. Is there's that bond between the caregiver and the patient. A couple other things about what it is. It's very closely linked to empathy. So if you think about that, empathy is our ability, to feel another's emotion or to put ourselves in someone else's situation. And it's that empathy that builds the bond. And also, if you think about it, if you weren't able to really empathize with another individual, you might not get as emotionally invested or emotionally invested enough to actually develop compassion fatigue. So it's very closely linked with empathy. I'll also say it's not pathological. So, it really is the result of caring deeply for others and being overly empathetic. And what happens is eventually, if you kind of progress or someone progresses all the way to full-blown compassion fatigue, it results in this lost capacity to kind of feel compassionate, or just a diminished feelings of compassion. So that's technically what we're trying to avoid. I want to just touch on the related terminology. And the reason I'm doing this is because there's a lot of, I don't want to necessarily say confusion, but it can be confusion, but a mixing up of terms in the literature. And I want to make sure we know what we're not talking about so that we can focus truly on compassion fatigue. So one of the concepts that, or terms really, that compassion fatigue is confused with sometimes is secondary traumatic stress. And the reason being is that secondary traumatic stress and compassion fatigue both have very similar symptoms. In fact, they're identical. And, you know, secondary traumatic stress is the result of feeling stressed by caring for a primary trauma survivor. The biggest difference between STS and compassion fatigue is that secondary traumatic stress can occur with a single encounter, whereas compassion fatigue, like I said, it develops over time. It has a bond associated with it. And my best example of this is my husband is a volunteer firefighter and EMT, and I believe that he experiences secondary traumatic stress after he, say, is on a fire call and has to rescue someone from a burning building, or takes a severely injured patient extricates them from a car. So that's a single encounter. He's not experiencing compassion fatigue, he's experiencing secondary traumatic stress. Vicarious trauma is typically, it's something that builds over time like compassion fatigue, but it's more so between a clinician and their patient, and it's the result of the patient's graphic descriptions of their trauma experience that then the therapist will take on and assume those emotions. So example being, if a therapist is treating somebody who survived a war, and then all of a sudden the therapist, after hearing all these graphic descriptions, starts to dream that they're in a war, or have overreactions to thunderstorms or fireworks, that would be vicarious trauma. Again, the symptoms pretty much identical to compassion fatigue. And then burnout is the other one. I think most of us are familiar with burnout. We know it occurs in work environments that are overly demanding, where there isn't a lot of support or work-life balance from an organization. But burnout can occur from sitting at a desk or staring at a computer screen for 14 hours a day. That's not going to be compassion fatigue. Again, the bond and the emotional relationship is what distinguishes burnout and compassion fatigue. But I will say many people who have compassion fatigue also have burnout. So symptoms, and as you can see here, these symptoms are very similar to many other things I'm sure you're all familiar with, not only what I just spoke about, but also post-traumatic stress. So, depression, anxiety, sleep disturbances, all of these things are also symptoms of compassion fatigue. So I would say that what's most important when you're assessing whether someone might have compassion fatigue is to really inquire about their experiences that might be contributing to these symptoms. For example, when I sit down to recruit my participants for my study, my dissertation, not only will I want to make sure that these animal care professionals have some of these symptoms, but I will want to ensure that not only are they experiencing these symptoms, but they have been involved with suffering animals. So they've been exposed to animal suffering. They've been trying to alleviate, maybe unsuccessfully, pain in an animal who is sick or injured, and that they have a bond. So they feel a connection. They have that human animal bond with the animal. So those are important considerations when assessing for compassion fatigue. I'm not going to talk a lot about assessment, but I will say that I did include at the end of this presentation, there's a lot of references for you. And I also included a link to the Professional Quality of Life Survey. Some of you might even be familiar with it. It is one of the most widely used tools to assess for compassion fatigue. And it assesses for compassion fatigue, compassion satisfaction, and also burnout. So there are 3 separate scales within that tool. There is a link to it. It is one of the, I would say, most reliable, valid tools out there to assess for compassion fatigue. It's not the only one, but it's just a very popular one. Okay. So who's at risk? Well, like I said, helping professionals, including animal caregivers. And we're going to get into exactly what happens or what makes someone more susceptible to compassion fatigue, because not everybody who is a helping professional, an animal caregiver, is going to develop it. But there are some key things that we need to be aware of. We'll get into that a little bit more when I talk about the model and the trajectory of compassion fatigue. Those who have suffered past unresolved trauma. So if you think about it, if there's unresolved trauma in a person's history, when they're dealing with perhaps something that's overly emotional, like witnessing an abused animal or an inability to save an animal who they love or who they've developed a bond with. If there's unresolved personal trauma, their brain is not only responding to the current situation, but the nervous system is still responding to that past trauma. So people who have a history of trauma can be more at risk for compassion fatigue. I already mentioned higher empathy is a contributing factor for risk, as well as a close bond. Interesting, younger age and less job experience can be a risk factor. And if you think about this in terms of a lot of young, and it's not just young professionals, so I don't want to make that a blanket statement, but research does show that if there's younger and less experience in the worker, they might be more enthusiastic. They might be less likely to kind of step back, take a break, or do things like practice self-care because they're so enthusiastic. And that could really be any age group, but it just seems to happen more so with the younger and less experienced professionals. Again, those who don't practice self-care. And we will talk a little bit later about self-care and how that is a big way to alleviate and manage compassion fatigue. But if people aren't willing to do that and take that time, it's going to put them at higher risk, as well as not having an adequate social support system. Big alleviator and manager of compassion fatigue is to have people who you can talk to, have outlets, have people you can go to and share what you're experiencing. And then this last bullet here, those who tolerate overwork and exhaustion for results. So if you think about, high achievers, really willing to go all out and push and just do whatever it takes, often at the expense of their own well-being, just to take care of the next patient or save the next animal, that's going to put them at higher risk. Okay, so let's talk a little bit about animal caregiving and compassion fatigue and how it started. So Charles Figley, he was the first to associate compassion fatigue in the animal care community. And this was during stress management workshops that he was actually doing with animal shelter workers back in the early 2000s. And so if we think about the life of an animal care professional or animal care worker, it is filled with such a range of emotions. It's the joy and the satisfaction of saving an animal, or, just being able to, see an animal get adopted. That's all these things that fill animal care workers with the joy and the satisfaction of what they do. And it's also filled with a lot of emotional turmoil from animal neglect, animal abuse, euthanasia. And these experiences often happen in a very short period of time within one day. For example, I have a friend who works in a veterinary practice. She's a vet tech, and she just a few weeks back gave me an example of what her day was like. And it started with having to assist in euthanasia for an animal and a family that she had grown very close to over the year of caring for this animal who was sick. Very hard 30 to 45 minute appointment. Then immediately followed by a puppy appointment where there was joy and, new shots. But here's the thing, she doesn't get time to transition her emotions. So she's got to go from one to the other. This goes on for her all day long. She ended that day with a client coming in and needing the cat, I think it was a cat, had a bowel obstruction, needed surgery, but it's not a 24-hour clinic. So the vet had to refer the client to a 24-hour clinic. The client blew up, obviously, emotions. So it was just a very hard day for her. And when I asked her, well, what did you do with like all that you were feeling when you got home. And she said, and this probably won't surprise you, I drank a bottle of wine. Now, she knows not the best coping strategy. And she's like, I know you're going to tell me I shouldn't have done that. And certainly she could have done different things. But the point is, that is could be a very typical day. And she doesn't know enough to be able to manage the emotional toll of her work. If you go to an animal shelter and you talk to an animal shelter employee, it's different, but the emotions are the same. So animal shelter employees are the ones who have, you know, they're dealing with the relinquishment of pets, or animal control officers bringing in stray animals, neglected animals, and they're seeing all of this neglect, abuse, and they have to deal with that. And they have to deal with the behavioral issues and the euthanasia. And they also have to deal with, you know, the sadness they feel when an animal leaves to get adopted. And even though that's wonderful, it still is a loss for them, who they've developed a relationship with these animals. So this all leads to compassion stress. And that's what Charles Figley says is the path through which compassion fatigue develops. So if you think about compassion stress, is that stress response that animal caregivers are experiencing as they're constantly dealing with this range of emotions, and they're feeling a demand, really, and it might be a demand they put on themselves, but they're still feeling it, to alleviate the pain and the suffering. And if they're not able to appropriately manage that stress response from being so compassionate, it's going to route them to compassion fatigue. And that's what I want to talk about next. How does compassion fatigue develop? So there are two models I'm going to share. I'm going to give you this one. I'm going to pull it all up here so you can see it. And then I'm going to go back and talk to you about it in stages just to explain it. But this is Figley's compassion, stress, and fatigue model. It's a very well-known, well-researched model in the literature. And basically what it is it describes the 10 factors that he says, and has, you know, this has all been validated in the research, but this is the path through which compassion fatigue typically will develop if an individual experiences all of these factors. So let me back up here. And what I'm going to do is walk you through this in stages. And I'm going to just give you an example of a woman I know. I've been working with her in animal rescue for many years. I'm going to call her Megan. It's not her real name, but she has been volunteering in animal rescue a long time, probably 2 decades. And she currently, I know her through a shelter, a local shelter, and we have been on this journey together of saving animals and feeling very called to do so. And so Megan, anytime she is at the shelter, she experiences number one on this model up here. You can see this exposure to suffering. So basically, sick, neglected, abused animals constantly coming in. She's constantly caring for them, but she's exposed to that on a regular basis. And that is the first factor in this progressive model. The second one, empathic concern. So this is where we get into the empathy piece. Megan is very empathetic. She has a very strong connection with the animals, and she feels distress about their suffering. And this is the second factor. So it's her concern, this empathic concern, the unease that she feels about their suffering that kind of motivates her to take care of them. As does number 3, her empathic ability, which really is just an individual's capacity to have empathy. And if you think about that, I mean, some people are more empathetic than others. It's just it's how many of us are wired. Megan is very empathetic. So her exposure to suffering, empathic concern, and empathic ability are all driving her to respond with empathy to the suffering animals. And that empathic response, if you think about it, it is actually the perfect response for any caregiver, because that's what, you know, people who are suffering need. They need somebody to respond to them with empathy. So it is a perfect response. It's a strength of Megan's, and it also can be a weakness if she doesn't manage it on this path to compassion fatigue. So then we get to the second group of factors here. And number 5 is detachment. So basically, this is exactly what you think it is. It's the ability to detach from your work or your feelings of empathy and compassion. And it is number 5 on this model. Detachment is actually a mitigator of compassion fatigue. And the reason it is placed here on the model is because at this stage along the progression, it's really important to have something that can potentially halt or hinder the progression along the path to full development of compassion fatigue. And detachment is one of these things. For Megan, it's very hard for her to detach because she feels extremely committed to doing what she does, and that is saving animals. Sense of satisfaction, number 6, that's another potential mitigator of compassion fatigue and is exactly what you think it is. It is the satisfaction that one gets from doing their compassionate work. It's the positive emotions associated with it. And even though Megan feels a lot of satisfaction about what she does in animal rescue, she also allows the negative aspects, the animal suffering, to override her sense of satisfaction. So for her, her inability to detach and really get the most satisfaction out of what she's doing is leading her right to residual compassion stress, which we talked about compassion stress. And this is just her lingering stress response. She constantly feels the pull, and it's more about stress, to do more and more to alleviate the suffering of the animals that she cares for. So now she's along the path here and she's gotten to number 8, which is prolonged exposure to suffering. So again, you know, the first factor here was exposure to suffering. That doesn't stop. And it kind of compounds, if you think about it, because Megan's not detaching or really getting a lot of satisfaction anymore. So she's prolonging the exposure to the suffering. She also has number 9, which is traumatic memories. And that's what we talked about earlier, the personal trauma. So for Megan, and because I know her, I know this, she did have some childhood trauma. I don't know that whether it's resolved or not. I do know that she has trauma associated with losing her own pets, and also just the work that she's done all through the years to rescue animals. She has traumatic memories associated with that I don't believe are resolved. And so she's being triggered by all of this. And then other life demands. So other life demands is really just life. So it's her job, her real job. It's her son, who is, you know, I mean, currently just went away to school, and, you know, COVID. So there's a lot of stress there. And it's her parent not being able to see her parents. She just has all these other things going on, and she's not managing it. So her inability to manage the stress has put her right on this path to compassion fatigue. I will say that I think Megan's unique. I see bits and pieces of these things in people. I also see a lot of people who don't really get affected by a lot of the things that they do in animal work. But the research has shown that if individuals are experiencing all of these factors and not doing anything to help alleviate the emotional turmoil associated with the work, they're going to put themselves right on that path to developing compassion fatigue. And so again, this is one model that's very popular. The other one by Ann Baranowski and Eric Gentry. So this one doesn't really have a name, I don't think, but it's this trajectory of compassion fatigue and its phases. I'll talk about the phases a little bit more, but you can see here that it's plotted performance against time. So you start at the top, which is the Zealot Phase, and your performance is really high. And that's when you haven't been on the job very long. So the time span is short. And then as you progress through the phases, irritability, withdrawal, and then zombie, which hopefully you'll never get to, or we don't want to see people get there. But as you progress through the phases over time, performance significantly declines. So the Zealot Phase is what you would think, exactly what you would imagine. It's the individual is going the extra mile, not even being asked. And I think this image here kind of is a is interesting because this person is just doing all they can. They're leaping over cliffs and their head is cut off in the image, which I thought was a good depiction of what could happen if you don't manage that enthusiasm of, you know, wanting, like, for animal care professionals, or just that I want to save all the animals. Many people, I've spoken with a lot of people at the Humane Society, and I feel like a lot of their volunteers will come in and they think we are going to save all the animals. And wouldn't we love to, right? But that's not realistic. So we have to manage the enthusiasm. If not, they can go to the irritability phase. So again, pretty self-explanatory. It's starting to make mistakes. You're irritated, you're cynical. You might even start distancing yourself from coworkers and friends. So, you know, you can see people in this phase, their enthusiasm has declined, and now they're a little kind of annoyed, and they might be just cranky, basically. That's really what it is. They get really cranky. And then if not managed or not aware, you know, again, many animal care people, and we'll talk about this, they're not aware. They're not even aware that any of this is going on. So suddenly they're not happy. They're sour. They're tired. They don't want to talk about anything. There's a neglect sometimes for family, friends, coworkers, and also avoidance. And I gave the example before of my vet tech friend who went home and numbed all of her emotions with wine. And certainly that's not uncommon to use substances, whether drugs, alcohol, to try and avoid or numb the pain. And then hopefully this is where we want to prevent people from getting to, but Anne Baranowski and Eric Gentry call this the zombie phase. And it's literally people are on automatic pilot. It says here, hopelessness becomes rage. I think hopelessness is a big part of this phase though, because they just suddenly are like, I can't even help one animal anymore. There's a kind of rejection of other people. And then what I talked about earlier, you'll see this lost compassion. So their ability to be compassionate, which was once, you know, kind of over the top, has now been significantly diminished. Okay. All right. So now we know what compassion fatigue is, what it's not, how, you know, what some of the symptoms are and how we can progress there, how animal care workers can progress there. And what I want to talk about next is the unique factors of animal care work that contribute to the onset of compassion fatigue. And I'll be honest with you, when I started my research, this is not something that I was expecting to find. There are things about animal care work that other professions, doctors, nurses, therapists don't experience. And these unique factors definitely are contributors to compassion fatigue. I think it's really important to understand them, because if we're going to help them, we need to know what they're dealing with on a regular basis. So here's just an overview. I'm going to talk about all of these things, but you see we have the human-animal bond, moral conflict and the caring-killing paradox, euthanasia, animal work is a calling, disenfranchised grief, and then the stigma of animal care work. All of these kind of morph into the onset of compassion fatigue. I will just start this by saying any one of these factors probably wouldn't do it. But if you think about it, and if you know a lot about the work that animal caregivers provide and the service that they're providing to animals, they're experiencing all of these things on a regular basis. So let's start with the human-animal bond. I know you all know the wonderful, wonderful parts of this, because the research is just endless about all the positives that we experience as humans when we interact with animals. We know the improved cardiovascular functioning, reduction in stress, more social interaction, we're relaxed. You know, there's, when we make eye contact, when humans make eye contact with dogs, there is an increase in oxytocin in our bloodstream, which that's the hormone that is the bonding hormone that mothers are producing right after babies are born. So it's the love hormone. And if you know the dog, so if you know the dog and the dog knows you, there's an increase for the dog as well. So we know the beauty of it. And we also know that compassion fatigue, unfortunately, requires that bond and that caregiving relationship. So what ends up happening is that the human-animal bond can become a negative aspect of animal care work because of, and this is all, the research states this, it's an animal relationship stressor because animal care workers, like I shared earlier, they're just frequently exposed to a lot of trauma, abuse, and neglect, and they don't know how to manage their emotions. So there's this emotional toll of their work, and it's getting better. I shouldn't say this, but across like veterinary schools, for example, there's not a lot of education currently on how to manage the emotions. I mean, I've talked to my vets at my local practice where I take my animals, and I would say it depends on when they were in school. Some of the techs and the vets that are coming out of school more recently, they do have the benefit of, depending on where they go to school, some education about the emotional toll, but for the other techs and doctors who have not been in school for many years, this wasn't part of their curriculum. They can get it now if they seek it out, but they don't know not only how to manage their own emotions, but if you think about vets, they're also dealing with the emotions of the humans of their animal patients. So the bond that they develop with the animal, it becomes a feeling of loss because they are losing a lot of animals that they're dealing with. That's part of what they do, and they just don't recognize that it can be a negative aspect of their work. Animal rescuers have that, it's a unique view of the human-animal bond because they see a lot of breaking of human-animal bonds when pets are relinquished or people just, move and they leave their animals behind. So it's a different, they have a different perspective of it, and it can be a negative aspect of the human-animal bond. The next unique factor of their work is moral conflict and the caring-killing paradox. And these are related. So, moral conflict is what happens when caregivers or anybody really is required to perform work that conflicts with their personal moral code. With animal care work, this often happens because there's competing human and animal interest. So for example, if an individual brings their severely ill animal to the vet, and the vet knows that the most humane thing to do would be to put the animal down, but the owner of the animal is begging the vet to save the animal, that is a moral conflict because there's a competing human and animal interest. In animal shelters, if they are kill shelters, a lot of the animal shelter workers will see that it's not the best thing for the animals to be put down, especially if they're healthy. But the shelter is required or doesn't have enough space or funding to keep the animals there. And so this creates moral conflict. The Humane Society, there was a report that out of all the animals, this is an old piece of data, it's from 2014. I couldn't find anything more recent, but of all the animals euthanized in shelters in 2014, 80% were otherwise healthy. So that for an animal shelter worker is a huge moral conflict. And this is linked to the caring-killing paradox. And so you might be familiar with this. This is what happens when an animal care worker has to euthanize an animal that they have cared for. And so it creates a lot of conflict. Again, even though it's probably the most humane thing to do, it doesn't necessarily make it any easier. What the caring-killing paradox often does is creates this conflict in animal care workers between how they idealize their work and then the reality of it, because many of them, again, get into this work because they want to save and care for animals. And then when they realize that a lot of that is just not always possible, creates that conflict. So this contributes, the caring killing paradox and the associated moral conflict, it really contributes to the onset of compassion stress, because the animal care workers are exposed to suffering. It triggers traumatic memories. It does so many of the things in Figley's model that progresses one towards compassion fatigue. So again, these are very unique to animal care work, as compared to some of the other helping professions. And then of course, euthanasia. So euthanasia is affected by moral stress, caring killing paradox. That's really, it's when euthanasia happens or is required that these things typically, the moral conflict comes up. So research has shown that euthanasia can be one of the most stressful aspects of animal care work. It's interesting when I have asked some veterinary professionals about this, just not, nothing formal, just in passing. I know a lot of vets. It's mixed. Many of them say it's part of what they do. Others feel like it can be very stressful. It just depends on the circumstances. It also depends on what they can do to manage what they're feeling. So there's a lot about euthanasia that's very difficult. And then there's also other aspects of it that I think many animal care professionals know is just part of the cycle of life for an animal. But it is correlated with burnout, secondary traumatic stress, and it creates that sadness, guilt. It's all of these things. I feel like there's not enough information on, again, what do we do to help them manage these emotions that they will naturally experience by having to practice euthanasia. So this can increase one's risk for compassion fatigue, obviously, because it is contributing to a stress response, and it can trigger traumatic memories. It can create that feeling of constantly needing to do more and more to try and save more animals so that they don't get euthanized. So animal care work as a calling. Many animal care workers feel very called to do their work. You might agree with this. I know I do. So, a calling is just a strong inner pull to like an intrinsic motivation to do the work you're doing. And for animal care workers, it's personal experience with animals, love of animals, desire to help save them. I know for me, I was always the kid who didn't ever have a pet. I begged my parents. Oh, I think I started when I was 6 and I didn't stop till I moved out. But so I'm not kidding, like the second I graduated college and I started graduate school, got my own place, I got a cat, and it's been nonstop since then. But I always felt this pull that is very common in animal care work. Animal care professionals, many animal activists, they feel deep responsibility. Animals are innocent, they can't help themselves, I must help them. They feel very protective of animals. And therefore, it makes separating from work very difficult. So animal rescue workers and veterinary professionals will often, sacrifice their own well-being to take care of the animals. They feel guilty if they're not there, and they think, if they can't be there, then who's going to save the animals? And I know from being in animal rescue work for so many years, it takes an army sometimes to get one dog out of a neglectful situation. And there's this, if you don't manage it, there's this feeling of, oh my gosh, that's one. Like, what about all of the others? So it can be very hard for animal care workers to step away and balance things because they do feel so called and so they feel responsible. I just looked at the time. I need to keep moving quickly here. Okay, the stigma of animal care work. This is what the research says. And maybe I was like, oh, I don't really think I feel this way about animal care work, but it's out there in the data. So it falls into this category of dirty work because of The stigma associated with it. So dirty work is work that has dirty tasks, cleaning up after animals, keeping their kennels clean, assisting in performing euthanasia, and also having to dispose of animal bodies. So that's the physical stigmatization. It's the handling of the dirty tasks. Then there's a social stigmatization, which I think it's different in different cultures, but it's, if work is socially stigmatized, it's because you're dealing with people who are considered less than by society. So for example, animals, prisoners are another group that, correctional officers and people who work in the prison system are often considered to do dirty work, or even other marginalized populations. So the research does show that animal care workers feel misunderstood. And there was a study, and I'm going to share this with you, back in 2012, 499 animal shelter workers were surveyed regarding the dirty work nature of their roles. And they did agree that some of them, not all of them. So it depended on the level of dirty work. Let's just put it that way. So if a lot of them felt like the love of the animal and just being with the animals kind of just they didn't even think about any of the dirty tasks that they had to do, because it was the love of the animals and the being with them that overrode any of that. But for the people who were dealing with very sick animals, and also seeing a lot of the, animals can come into shelters looking pretty rough, and that dirty aspect, or having to deal with very aggressive dogs, that did create emotional strain. And it was enough in some cases, depending on the level of the dirty work task, to cause some of them to think about maybe doing other things. So it does have an effect. It does increase the emotional toll of their work. And the reason it can be compounding to the development of compassion fatigue, because a lot of times animal care workers, because of the stigmatization, they might not feel comfortable talking about what they're doing. Whether they had to be involved in euthanasia, or, an animal came in severely neglected, whatever it was, they might not feel comfortable talking about it, and then they isolate themselves. And that lack of social support, isolation, can, again, help them develop fully into compassion fatigue. So the last one of these unique factors is disenfranchised grief. And so that's secret or silent grief, when people don't feel comfortable expressing their loss. And disenfranchised grief is experienced in three ways. There's empathetic, which is the inability for others to understand the griever's loss. So for example, I have a friend who lost a cat, and someone at her work said, as I'm sure you've all heard things like this before, it was just a cat, why don't you get over it? And so somebody can't understand it. Political is the systemic failure of an organization to support a griever in their loss. So I don't know of many organizations that offer bereavement leave for pet loss as part of their employee benefit plan. I don't know. So I've been out of the corporate world as an employee for 10 years now. When I was there, it was not offered. I know some organizations do, obviously, but it's not widespread. And then there's the ethical disenfranchisement, when grievers are disrespected for their grieving. I think these are all related. I don't know how we can separate them, but they are related. And animal caregivers experience all three types of this grief. I will share another piece of research here. There was a study done in 2019 by Martin et al., and it was 169 animal care workers. And the study was done to research the psychological distress of the workers and the disenfranchisement of their stress and grief. So the results indicate that over half of the participants experienced depression regularly, and over 1/4 reported a persistent lack of energy and fatigue. 47% of the respondents felt grief similar to human loss when an animal they were caring for left their care. The results also showed 69% didn't feel their organization advocated for their well-being or acknowledged the emotional distress that they feel as a result from working with and sometimes losing animals. And 25% of the respondents felt that their work caused enough distress and there was enough disenfranchisement to force them to seek other employment. So again, this is unique to animal care work, and it's something that contributes to compassion fatigue. Okay, so what do we do? There's so much. So this is, I call this the toolbox. There are so many things that we could be doing, and I think, it's kind of like when we want to save animals, let's just take one step at a time. And so if you know someone or an organization that is struggling with this, how do we help them? I'm going to say education and training is primary because it is so critical for the prevention and management of compassion fatigue. And it's not widespread enough. I feel like a lot of, and I do feel this way personally, but I've also seen this in the research. Animal care workers don't always, maybe this is like just any one of us, they're just not paying attention to really what's going on with them because they're so devoted to what they're doing. So they're not aware. They're not aware that, feeling anxious or depressed or not able to sleep or bottling up my emotions all day long and then just thinking they're going to go away that's not normal. And I think a lot of people think that's normal. So education, training, key to prevention. Another key to compassion fatigue resilience is to calm the nervous system. So this is kind of all over the research. Compassion fatigue, it can become a conditioned response, meaning that if you think about my example from earlier of Megan and how she was constantly exposed to suffering and she's constantly trying to help all these animals. And so what happens is her brain starts to fire and send messages to her nervous system that she needs to, help. And then she's sad and then she feels guilty. And so this is like on repeat. And so being aware of what she's experienced is a key to help her alleviate the symptoms and then manage them moving forward. So recognize, acknowledge, and reframe. So we have to help animal care professionals recognize what's going on with them and acknowledge it. So, it's okay to say, I need to take 10 minutes and go into the bathroom and gather my emotions. We need to help them acknowledge and allow themselves the space to feel what they're feeling, because if they don't, that's when these symptoms really can take hold. And so recognize, acknowledge, and reframe. And the reframe part is where really, I wish there was just like a magical way to just say, hey, this is how we reframe this situation. But as you all know, reframing a situation is different depending on the person. So we have to help them figure out the story. What's the story that they're telling that's causing them all of this turmoil? And then let's reframe it. And there are ways to do this that I'll get into in 1 second. But self-care is another big one. We have to help them take care of themselves. I know some of this seems like really basic, but it is. And that's part of it. It's sometimes the most simple things we can do can make the biggest change. So self-care, sleep, nutrition, and movement. Let's just start there, because if they're not taking care of themselves at the most basic level, then they're not going to be caring about deep breathing exercises or trying to do meditation or any other relaxation techniques. But that's really making it as simple as possible is a starting point. And so that then they can recognize when they're feeling these emotions, acknowledge them, and reframe them. EMDR is on here for it's eye movement desensitization and reprocessing. And many of you may be familiar. It's, how we reprocess the firing in our brain. It's a very special technique that many therapists use to reprogram the neurons that have been, firing erratically, dysfunctionally because of trauma. So it's unprocessed trauma. And if we can get some of the personal trauma, and it doesn't have to be like, serious trauma. I think we all experience trauma at different levels in our lives, and we need to process it. We need to feel those emotions of that trauma so that we're not being triggered by caring for a sick animal, if that is what we do for a living. Connecting with others, creative outlets. Again, these all seem basic, but I'll give you an example. So connecting with others, grief loss support groups for animal care professionals who are dealing with, whether it's they've lost an animal, whether it's they just don't know how to process their emotions. Getting them together in a group to talk about what they're feeling is so helpful. Creative outlets. I'm just going to say outlets in general. They don't necessarily need to be creative. I worked with a vet recently and not every veterinary practice can do this. Some of them actually have veterinary social workers on site. If they don't, can they create a space in their practice to help their staff just have an outlet after they've had a day like my friend had a couple of weeks ago, where she went from appointment to appointment and then couldn't even process any of the emotions that she was feeling. Sometimes all they need is 5 or 10 minutes to gather themselves. That type of outlet is critical to manage compassion fatigue and help alleviate it. The last thing on this list here is the Accelerated Recovery Program. So this is a very specific program that is designed to think about somebody in the zombie phase of the compassion fatigue trajectory. Maybe they don't have to be all the way there, but they're on their way there. And this is actually, you can get a lot more information on this, and you can actually become certified to deliver this type of program. But what it is a 5-meeting protocol, 5-session protocol to treat compassion fatigue. And I'm going to give you a very brief overview. And again, I would encourage you, there is a link to this in the references, but there's a lot of information that goes along with this. So basically, think about it this way. The first session would be an assessment. So you are assessing the client for compassion fatigue, trauma, and clinical stress. The second session would be uncovering the story, the narrative that's going through the client's mind, that's triggering their nervous system to have these emotional reactions. So it becomes a timeline of what they've experienced that maybe even feel similar to what they're experiencing in their work today. That's the second meeting. The third meeting, this is where I feel like it needs more than just one meeting, but the third meeting is the processing of the trauma. So this is where you start doing things like EMDR or cognitive behavioral techniques to help uncover what's the story are they telling themselves. Is it they have to save all the animals, that if they can't save this one, they're a failure? What is it that is helping to contribute to them feeling the emotional turmoil? It might just be that it's built up over time so much for them, and they've never really done any of the self-care techniques, that they're just having this experience now. So it's helping them kind of reframe. This is where the reframing happens. It's in the session. Reframe the story. What's causing the excess nervous system reaction? The fourth session is resolving the trauma, so to speak, or just the compassion fatigue response. So here's where you help the client put a plan in place. How am I going to manage this? What self-care techniques am I going to regularly be practicing? What affirmations am I going to use? What type of support system do I have? How am I going to, am I going to journal? Can I write about this? Like, what am I going to commit to doing to manage this response? And then the fifth session is the closure and path forward. So again, very brief overview of the Accelerated Recovery Program. I've gone through a training on it. I haven't used it. So I'll be honest, I just feel like maybe some of you can share more with me, but I feel like it needs more, but I've never actually done it. I've only been trained on it. Apparently it works well. So I think it's an individual type of thing too, because you really need to hone in on what the individual is experiencing. Some of these other things though can be done certainly as a group to help educate and train animal care professionals. I realize I went through that really quickly, so you can always reach out to me if you want more information on any of this. Helping diverse populations, I really want to touch on this because, animal care work spans all populations. And I think different populations are going to experience compassion fatigue differently and have very drastically different experiences. For example, there are the animal rescue organizations, animal shelters that have facilities that, you know, are beautifully manicured and clean and staffed well. And then there are those in, you know, the middle of a large city that they're just not good situations. They're overcrowded, although I know COVID has changed a lot of that, but it's hard for the workers to keep up. And so we need to be aware of these differences, and regardless of that, be providing education and training material so that the animal care workers can recognize what's happening and be aware of it, because the key to prevention is education. What is it? What are the symptoms? What's causing it? How can I manage it? What I just talked about really applies to all populations of animal care workers, regardless of where they are working or who they are working for. But the challenge and the opportunity really lies in ensuring that this information is available. So I know for me personally, one of my reasons for doing this research that I'm doing is because once I do it and I have data, I want to share it, and I want to provide information to animal shelters in some capacity. I don't know, a flyer. I haven't gotten that far yet, but I feel like it's incumbent upon me to be able to share this so that people know what they are experiencing, and that it's normal, and that they don't have to go to work feeling anxious, depressed, go home feeling spent, exhausted. They can continue to save animals and be fulfilled by it and not be exhausted by it, because we don't want to lose them. And that's the danger. So I think it's incumbent upon us to really provide them with as much information and make ourselves available to share this information to anybody who might present with these types of symptoms. And then finally, I want to close with how we help ourselves, because we have to take care of ourselves as professional helpers. I don't know what you do, or, you know, what your work is, and maybe you just volunteer too. I mean, for me, I'm a volunteer animal care provider, and I know how hard it is. So I think this information applies to all of us. I think we have to be aware of our own triggers, and when we may be in danger of maybe advancing from zealot to, you know, irritability down the chain there. We have to be an example and take care of ourselves so that we can then provide the best care for our clients. And again, with the goal being to help them so that they can continue to do the work to help save the animals. And so with that, I'm going to stop talking and see if you have any questions. And again, I included my contact information because I could probably just talk about that last slide about how to help for another hour. So if any of you want more information or more details, there's something that you want me to cover with you or just share more information, please don't hesitate. You can always reach out to me.
Well, thank you so much, Andrea. I really appreciate that. Was a extremely valuable and full of information webinar that you just created.